Good afternoon. Welcome to COVID-19 webinar series, our 8th webinar of this series. My name is Yasmina Sisterak, and I'm your host for today's webinar. Thank you for joining us. COVID-19 webinar series are presented by the HealthMatters program in the Department of Disability and Human Development at the University of Illinois at Chicago through continued partnership with Project Surge and their funding from the Ohio Developmental Disabilities Council in collaboration with Aspire Community Services in Illinois. We have added a summer webinar series to provide a space for community providers to share their experiences in maintaining services for people with intellectual and developmental disabilities during the COVID-19 pandemic. These webinars will be recorded and archived. We usually archive within a week, and you will be able to view them on our YouTube channel. We send an email to every registrant of the webinars. During the webinar, please note your questions in the chat box or the question and answer box, and then we will ask these questions during the last 15 minutes of the webinars. So for today's presentation, we're continuing with reports from the community. Our 8th in the webinar series is communicating COVID-19 updates to people with intellectual and developmental disabilities, caregivers, and stakeholder providers. And we're delighted to have Maggie Hassler, Director of Executive Communications at Aspire, presenting this webinar. Maggie is highly skilled at achieving fast growth and big wins by aligning organizational vision with messaging and strategy. She offering specialized expertise in acquisition planning and strategic partnering to drive growth and achieve measurably greater impact. During the presentation, Maggie will cover the development of an organizational infrastructure to prepare employees for disruption due to COVID-19. She will also discuss preparedness communication plans for people with intellectual disabilities, teams, families, and community, and also delineate the best approaches to universal messaging for people with intellectual disabilities, employees, families, and community during COVID-19 pandemic. Again, ask your questions in the text box, and thank you again for joining us. And Maggie, welcome.
Thank you so much, Yasmina, for the wonderful introduction. I've really enjoyed the webinars thus far in the series, and I'm excited to be here talking to like-minded people about communicating COVID-19 to people with disabilities, caregivers, and stakeholders today. So today I'm sharing the steps to outline and create your very own individualized crisis communication plan. And I'll be sharing Aspire's specific experience and approach to communications during COVID-19. So for context, we are a multi-service provider. We offer employment services. We have day services that provide life enrichment and skill building with a focus on health and wellness. In fact, we're an early adopter of the HealthMatters program. And so we offer behavioral health services, and we offer inclusion consulting, how companies and community spaces can include people with disabilities in the community. And we have a number of social enterprises as well, so Aspire CoffeeWorks and Art360. Today, I'm going to be primarily talking about communication plans as it relates to our residential services, because that is and was the most concentrated and intense communications. Lighter communications went out to our day program services, and they were mostly based off of the communications from residential. So we have 24 community homes, and we also support apartment living. What else is really important for you to know about Aspire is that we're located in the Chicago suburbs all the way up to the border of Wisconsin. So our communities were considered one of the most hard hit by COVID-19 from the very beginning. Aspire paused day services back in mid-March ahead of the state guidance, and we're potentially reopening. That is slated for September. And so additionally, we follow guidelines defined by the Department of Human Services, so DHS, to advise on our visitation policy and reentry. And even though it's been a very short time, I think we can all agree it's been a very long road. So while many organizations in our communities and those nearby really struggled, around this time, thanks to our amazing participants and our team and their preventative measures, we were able to push our first confirmed case of COVID-19 in our community homes out until May. And we're really proud of this. So since then, we had a total of 8 out of 152 community home participants test positive for COVID, 4 out of 184 direct support team members, and 2 homes out of our 24 were directly impacted. So we're happy to report that everyone has recovered and we have no current cases. But that doesn't mean that this wasn't a very challenging time. And today I'll be sharing with you how we communicated during these difficult times. But before I do that, I'd like to share a crisis management communication case study with you. You may remember the Tylenol murders back in the 80s. And before the crisis, Tylenol was one of the most successful over-the-counter brands. At this point, an unidentified suspect tampered and poisoned the Tylenol capsules and returned the bottles to the shelf. So 7 people died from the poisoned Tylenol, and customers were terrified to use the brand and stopped buying out of fear. This could have taken Tylenol completely under. Tylenol got out ahead of it, though, and they were faced with a choice, risking more death or removing the product from the shelves. And in the public's best interest, and that's really the focus here, is that it was in the public's best interest, they recalled all the Tylenol bottles, which valued an astounding $100 million. So at that point, they started a hotline for open communication. They halted all advertising, and they sent warning messages to doctors' offices. Then, to regain customer trust, they were the first business to relaunch with a tamper-resistant packaging and did presentations around the country with doctors and hospitals to convince them to keep recommending the product. So they handled the crisis with transparency, which is key to your credibility and your reputation. And in 2 months, Tylenol had made it full circle and was, and still is today, America's top pain reliever. So I share this story because it's a remarkable example of crisis management. First, you do everything you can to save lives, like the precautions your organization put in place to stop the spread of COVID-19. You stabilize the operation of your business. And the third is to save and to build trust through communications and transparency. So it's this communication piece that I'm going to be connecting with you on today. Communications is the glue that holds everything together, and it's also what can make or break your credibility as an organization. So going back to March, when COVID-19 hit, there were a million things that had to be done. The first order of business in any crisis is ensuring that people are safe and to start to manage the crisis. Immediately after, you can begin to communicate your response. You may or may not have prioritized communications, but if you didn't, the need soon became a reality. People were confused and scared. In an environment without clear communications, your agency may have been inundated with a million frantic phone calls from family members asking questions, team members engaged in the rumor mill because they were looking for information they didn't get from leadership, or participants who may be confused about why they have to stay home or the fact that their routine has changed. So you've spent years building and maintaining this trust with your stakeholders. And in a situation like this, there's a real possibility that a lack of communication can create a perception of wrongdoing. We can't afford mistrust right now. So how do you avoid all that? It's all about clear communications and transparency, sending a positive message and demonstrating leadership, capability, empathy, and trust. By keeping your participants, families, and team members updated and informed, you can transform these groups into receptive partners. Today, I'll be talking to you about how to best communicate in times of crisis, and I'll discuss preparedness communication plans for people with disabilities, families, team, and community. So what is preparedness communication plans? Or another way to say it is a crisis communication plan. This is how you are going to communicate with your stakeholders about your organization's response to the crisis. From here, I'm going to dive into these preparedness communication plans, how you can develop a communication plan. If you're interested, I highly recommend that you take down the questions. I'm going to be giving you 5, and I'll share those on solid color slides. These will help you develop your personal preparedness communication plan and help you delineate the best approaches for consistent messaging during the COVID-19 pandemic. But if you're more interested in hearing about our plan, feel free just to listen in. Each area I'll pause to share how we at Aspire approached it so you can get an inside look at our communications. Then we'll dive deep, looking at examples of some of the hardest communications, our first confirmed case of COVID-19, and sharing the number of cases after that. So then I'm going to jump right in to our first question when thinking about your crisis communication plan. You want to identify your audiences. The first step is sitting down and making a list of all the people or groups of people that need to be updated. So another way to think about this is, which is a little different, is who is invested in your organization and specifically your response to COVID-19. So you can see here, this is how Aspire answered that question. All these audiences are going to have their own needs and a different frame for how they look at the crisis. There's going to be participants. There's probably no one else as invested in the services that you provide as the people who benefit from them. They are now at home and they're with their families or their roommates and maybe wondering when they'll be coming back, potentially missing their friends. Family members is another group. This has been really challenging time for this group who fear for their family members' health. Regardless of what measures you put in place for safety, communications are going to be key with this group. Team members, it's critically important to keep your team up to date and focus on your shared goals during this time so that your team works with you. And you need to prepare employees for the disruption due to COVID-19. These are your heroes. They have a responsibility of care. So they too have fear for the participants, and there's also a fear for themselves and for their families through this. The board, this is extra critical in a governance role, and you want to keep these folks in the loop as well as how they can help. Donors, friends, volunteers, and other stakeholders are really invested in your mission. So they are concerned about you on a number of different standpoints and levels. They want to help you. And then there's accrediting bodies. Because each one of these is so uniquely different, we're not going to discuss these as part of this plan, but keep them in mind as your plan if there are folks that you need to keep updated and be reporting to. So the next question for your crisis communication plan is who is communicating? The person writing or planning the communications may or may not be the communicator for these messages. You may have someone on your team who's an amazing writer who you choose to bring on board for the time being. Or you may have the spokesperson themselves. In many cases, this is the executive director planning the communications. As a reminder, it doesn't have to be one person who's communicating. It can be multiple people. And no matter who is creating the communications, it's really important that the right person is the spokesperson for those communications. So a spokesperson should not only have the skill to communicate and to answer questions, but they should also be the right person in terms of having the right position or title. To be a leader in your organization is really important because that leadership and that authority will calm and reassure your audiences. So for Aspire, we had a multiple number of spokespeople. For participants, we had our team members checking in with them regularly, of course, as well as our clinical team. And our chiefs communicated directly with our participants as well. With family members, our life consultants, which is typically their main person of contact, you might know this as a case manager. They are kind of the front line in terms of talking to our family members, and the Chief Program Strategy Officer, as well as the CEO, also communicated directly with families. For team members, it was really all about the chiefs and CEO getting that information from leadership, and then we also had our people, or you might call it HR team, jump in when necessary. So thinking about best approaches to consistent messaging, when you have multiple people working on different communications, I highly recommend, for at least the thick of it, having one person reviewing all the communications that go out. This ensures that you're sharing aligned information. The risk, of course, is sharing mixed messages with your audience, which could create confusion and even distrust. All right, so after you have your spokespeople set, the next question for your plan is, how often will you communicate? At the beginning of COVID-19 pandemic, all of us were adjusting so fast. Information was changing day by day, hour by hour. We knew as a nonprofit, we couldn't keep up with the same communication cadence as the news or other governmental organizations, but we also knew we needed to be ahead, or at the very least, we didn't want to be behind the news. So we quickly identified that weekly communications would be key for our families, our team members, and our supporters. Our participants were getting even more frequent information through a variety of channels. They were given daily communications with our support professionals. Your cadence might be different, but I encourage folks to have a regular communication. If nothing else, it provides calm and reassurance. It also heads off a lot of phone calls. So there was one week in May, we decided to forego our weekly email to families because we were waiting on more information to come in, and we thought we would email them when we had what we needed. The result is that we got a lot of calls to just about everybody. By not communicating, people automatically thought, I know something's going on, like what is happening? That weekend, we had more concerned phone calls than we received during the entire 4 months. So people suddenly felt like they were out of the loop. They got nervous and afraid as to why we weren't saying anything. Now, that doesn't mean that you can't change your cadence. You can, and it probably depends on what you're hearing from your audiences. But in March, April, and May, those constant communications were really critical. Today, we're sharing about every other week or so. So question number 4 for your crisis communication plan: how will you communicate? In today's world, we have the ability to reach out to different stakeholders using multiple modalities, meaning we have all sorts of ways we can share our message. The best approach when communicating in times of crisis, it's really critical that you have a way of communicating with people that's both fast and accurate. If you were to mail weekly updates, it may take you days to print the letters and the envelopes, and then days to mail it. And by the time the recipient got the letter, it would be totally outdated. In the beginning of COVID-19 pandemic, our team immediately went into action all email addresses possible we collected from family members and others that we didn't already have. Emails were actually pretty difficult to get from our family members before this, and this really spurred our family members to give us their email so that they could be updated on a regular basis with speed and accuracy. So this allowed us to send some really timely communications out quickly and relatively easily. We also used email, phone, and we utilized some very familiar and some totally new technologies, which I'm sure many of you have as well. We had a dedicated section on our website. We had daily Zoom calls with our participants. A lot of updates were integrated into service offerings so that we were able, so that we had that capacity and we could manage that lift. We had weekly family, team, and donor update emails. We had monthly or as needed video calls with our team members as a larger group and team. We had monthly family calls to our families, of course, from our life consultants, or what you might call case managers, and just to check in. And then as appropriate, we sent videos out as well, especially to our team, but also to other stakeholders. I want to talk a little bit more about the technology side because it's so important. This has been a great learning curve for us, and one of the positives that has really come out of this experience. We used to rely on material communications like flyers and letters, and we recognized that there was a really big technology gap that we needed to work on. And so we've become more and more comfortable with it every day, and video conferencing has become a really great platform for us. In our homes, we operate much like family home, so a lot of the discussions take place around the table. The communications is always really free-flowing and regular, including peer-to-peer. And then these communications that were natural and like a family were then reinforced through Zoom calls from our team members all the way up to our CEO. And so we layered on top of that, some of our participants are actually connected to our CEO via LinkedIn and Facebook. And communication happened that way too, some really informal communication. And those folks connected via social media continued the communication peer-to-peer, which was really empowering and really exciting. So this like really reinforced the importance and the power of technology as we move forward. We also utilize Zoom for our remote teams, giving 70+ people updates about once a month since we couldn't have an organization-wide meeting. And for all of our stakeholders, we really enjoy creating pre-recorded video updates from our CEO. And mostly that was because people are more likely to watch a video than they are to read an email. So why not meet people where they're at? Determining how to share, I also want to talk and call out pictures, graphics, and universal messaging. Finding pictures and graphics to support the communications was really challenging. Things we would have readily adopted were targeted toward children. We tried to work with the best resources we could find because there really wasn't time to create them. So in many instances, we relied on what we found on the internet. This is a little outside organizational communication plan and into more of a personal communication, but it's so important for folks to think about it. Like, how can you inform through universal messaging? I have here a few snapshots of things that we found, tackling what COVID-19 is, how to protect yourself and take care of yourself. But we were also really thrilled to find additional resources at one of the previous HealthMatters webinars called Talking About COVID-19 Resources for People with IDD. And I highly encourage you to go back to June on the HealthMatters YouTube and check out that webinar for more resources. All right, so now we have some ideas on how we communicate. So the final question for our crisis communication plan is how or what will you communicate? Excuse me. So what will you communicate? As I mentioned before, audiences are going to have their own needs and all have a different frame for how they look at the crisis. So they'll need different information. So how do you delineate the best approach to messaging? When you go to a specific group to communicate, you always want to share what is most relevant to them. There's always one overarching message for Aspire's communications, and that's right here. The health and wellness of our participants, team members, volunteers, and community is our highest priority at Aspire. And you're going to see this and how it weaves into every one of our communications. So let's take participants. We've focused on empowerment and how we could be part of the solution. Team members provided explanation and education around what COVID-19 is and how we stay safe, including staying home as much as possible. Together, we're consistently using best practices for hand washing, cleaning wipe downs, staying 6 feet away when in public, and wearing a mask. Beyond that, we're sharing how we can continue to uplift our friends and our families in this really difficult time. We also work with participants on how to self-advocate during this time. So for example, what would you do when you're sick, someone in your house is sick, or if you need to go to the doctor? Our team members talk directly with our participants on a daily basis and are really integrated, and updates are really integrated into the service supports and service offerings. So when it came to updates from our governor or the Department of Human Services, we shared that information immediately. Family members. When communicating with family members, we keep up and share with them all aspects of life. So one of the biggest concerns was health and safety. And so we shared over and over again the precautions that we're taking to ensure people stay well. For example, how the teams are keeping the homes well supplied with essentials like cleaning supplies, gloves, hand sanitizer, and good old-fashioned hand soap. Or how we're taking the temperatures of our team members when they arrive at work at the community home. In the beginning, it felt like, and I think it was accurate to say, that new precautions and updates were probably taking place every week, if not more often than that. But that's not all, because the second biggest concern for families is the potential for isolation. So we also continue to share how folks were living out active, healthy lifestyles even amid the pandemic, going for walks, healthy barbecues outside, chair yoga, or video chatting with friends and family. Let's talk about team members. So team communication really overlapped with family communication, except it had more focus on plans and procedures as well as safety measures specific to our team. So for example, in March, when the shelter-in-place orders came out, we addressed some of the most common questions we were getting. Specifically, there was concern that you might get stuck at work or not be able to come to work because there was the shelter-in-place. And we were able to address these concerns and questions and talk to our team members about how we are an essential business and they're essential employees and our heroes. So we also showed a lot of gratitude for our frontline team members to let them know how important their role in safety is and to keep them motivated. We said things like, "We're so proud of the amazing work you do. We continue to be grateful for your incredible dedication and the commitment to our participants. And thank you so very much for everything you do every day. You are essential workers and you are our heroes." The kind of gratitude, that kind of gratitude really leads to connecting us too, and the kind of teamwork that keeps everyone safe. So we would actually have calls to action with our team members as well, saying things like, let's join together to protect the health and safety of those we serve, our fellow team members, and our families. I think what's most important when communicating with team members is no matter what you're trying to get across, that it needs to be authentic. You need to do it authentically. Donors, friends, and volunteers. This time was really critical for us to connect with our supporters, show how transparency, So this was a really great time for us to show our supporters transparency and really strengthen our reputation. Donors, friends, and volunteers are hugely invested in your organization and they want to be a part of it. So I always like to think about making sure that you are sharing not only the situation and how it's impacting the organization, but also how it's impacting the people you serve and what you're doing to address those needs. So remind folks that your organization gives back. You're building communities. So for example, we highlighted stories of our essential workers, our team members, and also our participants who kept the world turning when everyone else was staying home. And we also balanced our outreach with asks for support and notes of gratitude. For example, we really needed masks and face shields, and we received those rapidly from our supporters, and that really helped us with our precautionary measures. Another best approach, if you're getting stuck on how to start or continue a communication, I always like to keep this in mind. Often it's much harder communicating with people, with like a group of people, than it is with an individual person. So there's a tendency to want to include all the information, but that's not what people need. Instead, they need to know what impacts them personally. And if it feels like you're getting stuck, choose one person's name, choose a specific person that you know that's in this group, and write specifically to them. Once you do that, you're pretty much off to the races because you're thinking about what they care about, what questions they may ask, and what they need to know. I always want to call out, you want to share the good. There were just like a few weeks when there weren't updates on services pausing or visiting and visitor changes and safety measures. And man, you got to take advantage of those. So share the greatest and the great things that are going on, what engaging and safe activities people are participating in, and those special moments that have occurred. And you always want to be monitoring. So if the news is reporting it, then it's most likely something people are going to be thinking about. This is how you start to get ahead of people's questions. So for example, I was listening to my favorite podcast, Start Here, and I distinctly remember the week that the news started talking about opening back up. And we immediately addressed this with our stakeholders, including our participants and our team members. We didn't know how and we didn't know when, but we knew it was going to be heavy on people's minds. And so that being the case, in that week's communication, we addressed it by saying, you're starting to hear about people opening back up. We don't know when we might happen, like when that might happen for Aspire, but we're thinking about when we do, how we will do that safely. So even if you don't have the answer, just addressing some of those things and that you're thinking about them or that you're planning for them is really key. So that concludes building your crisis communication plan. Now I want to transition into some pretty tough communications. The toughest communications to prepare for are when you have a case or you need to communicate bad news. And that's why all the work we talked about in the previous slides is so important. You've been keeping people informed and built trust and transparency. So when we did our analysis of communication chains, we realized everyone has importance, but the greatest massive groups we needed to keep informed were participants, their families, and our team members. So in many instances, they felt like they couldn't control the circumstances, and there was a sense of urgency to know how we were responding to ensure that health and safety. And so we needed these stakeholders to feel honesty and transparency in what was being shared. And all the pre-work that we did and talked about in the previous slides set this really solid foundation. And through it all, transparency is really the key element in sustaining and building that trust. So I'm going to take a few moments to communicate around individual health, because I think that this is really important leading up to potentially having a case. So communications around individual health was also treated with the same transparency at Aspire. If there was a change in health, any change in health, even a runny nose, we got ahead of it. So the individual, of course, was notified if they weren't already aware, and we shared that information with the family immediately as well. And that way, if in fact things escalated and the person does have COVID-19, the family is there joining you in the care. And I'm calling this slide out because it's really helpful when you had to discuss a confirmed case later. Here is simply an example of our communication, and this is a script for communicating an exposure. This is another example of how we were really proactive in communicating, and we used this no matter how likely or unlikely the exposure was. In fact, we also used similar scripts for potential exposure even. And again, this helped us create a team of care with the family. So now you've been keeping the family updated and a test result comes back. In the case of having a confirmed COVID-19 case, you want to have a step-by-step plan, and this is ours. So the first part of the plan is communicating with those impacted. So number one, the doctor calls the individual and the guardian or family contact, and then our team member follows up with a daily phone call. Then HR leadership and supervisors call team members who were exposed or potentially exposed. Life consultants call affected community home residents and their guardians for those who were impacted, so those exposed or potentially exposed. All those directly impacted should be notified immediately, and then after they've been notified, it's potentially time to share with a larger audience as deemed appropriate. Each agency crisis communication plan will look differently when communicating with stakeholders. At Aspire, we chose the road of ultimate transparency, and so we shared with all team members and all of our families. So let's take a look at this communication because it's pretty tough. Here you have an example of the communication. This is how our chain looked. You'll see a follow-up in the next slide. And this particular communication is from our Chief Program Strategy Officer. It gets straight to the point, letting people know we learned of our first confirmed case in our 24 community homes. It lets people know at the very top, and it's bolded, that anyone impacted was already notified. And this is there to help avoid some of that panic. And you can see that, again, we bolded it, so make that clear. Reassure people after that the person who did test positive is getting absolutely excellent care. You can include what precautions or extra safety measures you're putting in place. You can ask for positive thoughts, share reminders with your team to set expectations around respect and dignity, and then encourage people to keep going. We can't let up now. It's more important than ever that we, keep up those precautions and keep people safe. So finally, you'll want to end. Let people know where they can go for questions, because there will be folks who have questions. I now want to show you the next email. This is from our CEO, and it was a message of support as a reply to this email that you just saw, or this communication that you just saw. We only did this one time in terms of having multiple people communicate around that same thing, especially on the same day, and that was, really to signify the importance of it and having multiple people share the communication. And this is a direct reply to our Chief Program Officer's message that covered all the nuts and bolts of the situation. And then here from your CEO, you see that the message is really about support and reminding us to care for each other and to ask the team to recommit to staying strong, unified, and healthy. When we look at the family email the family communication here, then the family communication, it almost looks exactly the same as the team communication, as both audiences, team and family, need and want to know the same information here. With this plan, we got a lot of positive response. In fact, we had 2 family members write us back and thank us for being transparent. This kind of feedback was really incredibly helpful, especially when all the questions came in. So you will get questions, you will get concerns when communicating this information. So you want to be prepared for that and prepare your team for that. So here's another challenging one. Should we communicate our cases? Knowing the realities, our family members are going to call each other, they're going to talk, they may even guess who's impacted or confide worries with each other about how close this is to their home. Team members are also going to talk. In fact, we had one new team member ask their supervisor, "Hey, I heard there was another case. Is everyone okay?" And so we knew that people are going to worry, people are going to speculate, and we felt it's better to share the information versus the rumor mill, since rumors are only going to cause more anxiety and disruption. We thought, if you worked in a home or if you were a family member, you would want to know, and if you didn't hear, you would fear the worst. And we didn't want our stakeholders to fear the worst. And so we chose the route of complete transparency again. So here is our communication sharing some of the numbers of our cases. So people are hearing every day from our governors and businesses and so forth on the numbers. The bar is set really high, and so there is a really high expectation for what should be shared. And we debated back and forth about what information was too much. Ultimately, we decided that sharing how many houses had a case, so since all of them were isolated as their own individual islands, and then how many total cases for participants and team members. Oh, excuse me. So you can see that here. In terms of communicating, we put a spotlight on the good practices first, and then a secondary message is the numbers to date, which you can see on this slide. And then later, we were able to add a recovery column, and now we're back to communicating without numbers since all of our folks are healthy. And of course, it's up to each organization to really determine their own level of transparency, but ultimately the goal is that you maintain trust in your services and your brand. So I hope this was helpful to not only walk through some of the different elements of building a communication plan, but also hearing from another agency provider about how we have been taking on these challenging times. We found our communication plan to be highly successful in holding true to our personal brand and sustaining trust with people with disabilities, employees, families, and our community during the COVID-19 pandemic. because there's so much information here, and I know it, and we went through some of it pretty fast, what I did was I collected 14 of our communications as snapshots. So some of those things that you saw earlier in these slides, and I PDF'd them for you. And Yasmina will be putting that up as a resource along with the webinar recording on the HealthMatters YouTube channel. So look for that there, and I hope that it is helpful as you continue to prepare for your communication plans and determine the best approaches to consistent messaging at your organizations. So with that, I'm wondering if people have questions or if there's more information that I can share.
Thanks so much, Maggie. We are open for questions, so you can put your questions in a chat box or a question and answer box. One of the questions is, how do you communicate with individuals and families impacted who are from non-English speaking communities or having different communication styles like ASL or nonverbal?
Yeah, so I would look at how you're typically communicating with that group. So of course, if the case manager spoke the language, then you would want to be communicating with, you want to meet your audience where they're at. So you definitely want to be communicating as much as possible in the language and also in the, whatever that person is really able to best understand.
Thank you. What forms of communication for families have been of most benefit to people receiving services?
Okay, could you repeat the question?
What forms of communication for families have been of most benefit to people receiving services?
Oh, that's a good question. So I really think that it's the combination that makes it most helpful. So really keeping family members up to date on everything that's going on, what precautions you're taking, and having, really different modes of communicating that. Because having a conversation with your case manager about your individual, like your family member, your loved one, is going to be really powerful and impactful, especially when talking about how that person's doing and what activities they're doing, especially like if it's during shelter in place or whatever it might be. So I think those personal monthly connections is really important. We also reached out to families and we provided opportunities for them to connect in different ways during the pandemic. So we offered some really fun, unique things like they could, buy dinner and send it to the home, or they could put together activity packages, or they could do different things like that. And that was really powerful for both the participants and the family members because we had to come up with creative ways of connecting. I hope that answers the question.
Yes, let us know if that makes sense. In moving forward with all of the current uncertainties, what learning lessons are most relevant to you at Aspire?
Well, I think that, even beyond communication, we had to be very adaptable when it came to the pandemic. So, overnight, our service offerings completely changed. We went from being, day programs and services to being in our homes. And so I think when it came to technology and getting, being flexible and training our team members on how to take advantage of that, and now we have about 2 Zoom calls a day with different service offerings. and in addition to the service offerings that are happening in the homes. And I think that learning was really important for us, that kind of hurdle of the technology and really being able to adapt. This is a really unique opportunity in time where we're able to reevaluate because we need to. We were put in a position where you have to. And so I think that there is good that comes out of this. Another thing is that we actually acquired, merged with another organization about a year ago. And so I hate to say it this way, but, in terms of communicating and bringing teams together, this was a huge factor in that. Like, we already had a pretty great team, and the team was coming together, and it was looking really good. But there was no doubt that all of our teams needed to work totally hand in hand to do what we did over the last, since COVID-19 started. And I think that our team has become even stronger. And I think that that has been a huge opportunity and learning for us during this time.
Thank you. We have Michelle writing, congratulations on your approach. How would you critique how the pandemic was handled on a national scale? Did you have any parents that pushed back on your practices to maintain health and safety?
Okay, yes. So that's a really good question. I am going to focus the answer on parents pushing back. And we did have some of that, especially, we are receiving guidance from the Department of Human Services. So there is only we do have to follow those guidelines. So we are not reopening quite yet. We're still looking at September. And we definitely feel a push from our families right now to get back to normal routines. And so what we're asking our families to do, first off, we are compromising by making what changes we can right now in terms of getting people back into those normal routines. And we're also asking our families to be patient with us, but we're letting them know that it's coming, that even though it's not happening right now, we are taking extra steps. So your life consultant or your case manager should be calling you to talk about your family member specifically and some of the changes that can be made to return to some of those normal routines. And in the very beginning, when things were really in that shelter-in-place mode, we had, I don't think there was much pushback as much as there was maybe frustration. I think they understood it first. And then as time kind of went on, people were ready to get back into their normal routines. They were ready to have typical visits again and things of that nature. And we did have to draw a line in the sand a few times. And that line was if you wanted to take your family member home for a visit, that would be an extended visit. And at that point, we weren't sure when that person would necessarily be able to come back to their community home. But of course, since then, anybody who was on extended family visits are being welcomed back into their community homes now. So that's a really great thing to see.
Thank you. How about staff pushback or any pushback from service recipients?
Yeah, so I think from service recipients, there was definitely, everybody misses their normal routines. I mean, I sure do. And I think team members, participants, families, everyone misses those regular routines. So I think that there is pushback from all groups. I think continuing communication around what is changing, when it's going to be changing, oftentimes giving people a timeline can really provide a relief for some of that angst. And what was so frustrating about COVID-19 is that we didn't know what the timeline was for so long. And so I do think that there was some pushback, and then there's also some, really reinforcing why we're having to do this, that this is for the health and safety of everyone, not just you, but also, all of your team members, all of your housemates, all of your everyone. And this is where we're at and what we have to do right now.
Thank you. Do you have, or could you share any best practices for supporting service recipients to understand and manage ambiguity of the situation?
Oh, I am probably not the best person for that specific question, but I do recommend going back to the webinar in June from HealthMatters that was specifically about resources for people with disabilities, and I think that there may be something there for you.
Oh, Kathy Services webinar. I can put that in a chat box and share that. Thanks.
That'd be great. I highly recommend that to everyone. It was really a wonderful webinar that really went into some of the detail and the resources to specifically speak to people with disabilities.
Let's see, a couple of more questions. Don't be shy. Feel free to put them in the chat box. Let's see. Are there any communication successes that have resulted in permanent changes within the organization? And if so, what are those changes?
Oh, I wish I knew it was permanent. Everything is so different right now that I think that it's still going to be seen what continues to be used and what doesn't. I definitely think that now that we have a lot more of our family members' emails, that will be a more regular communication for us. I think that the technology-wise communicating with our participants and Zoom calls, being able to reach people that aren't necessarily in your geographic area, and this could also apply to team members as well, because we have a pretty wide scope in terms of our team members. I think that's been a huge eye-opening experience for us in terms of, we don't necessarily have to be in the same place to do really great work. And I think that that may be one of the lessons that comes out of this experience and these communications.
Thank you so much. Sort of last wrap-up message, do you have, what's next? Will you continue with these communication protocols? Kind of how are you planning for the future?
Yeah, good question. So we're starting to slow communications a little bit. So we're looking at once every other week. We're also planning for our opening back up. So we're still determining what exactly that looks like, but there will definitely be a communication, like a larger launch of those communications when it comes to that process. I think we'll also see a lot of individual communications happening at that time, because a lot of the return might be individualized. So I think that we will definitely be continuing with a regular cadence, specifically to our program participants, our family members, and our team members when appropriate. But definitely things are in a little bit of a lull right now, and then I expect them to build back up as we see more changes and different opportunities and returning back to our regular routines.
Thank you so much, Maggie. We're getting a lot of thank yous and kudos, informative presentation. Just to kind of mention again, the webinar is being recorded. The PowerPoints and the resources will be shared on our YouTube channel. And all of you who have registered will be emailed. Usually it's within a week that we post everything and make it available, so you will be able to share it. Again, thank you so much. We are at the hour. I won't keep everyone or anyone. Have a great rest of the day. And don't forget, next Tuesday, even during a crisis, people with disability have rights. I have posted a registration for that. I will repost it. Hopefully we will see you again on Tuesday. Thank you, and thank you, Maggie, again.
Thank you.
Bye.